Republican leader.
Mr. President, by now I'm sure every member in this chamber has received literally countless letters, emails, and phone calls from the millions of Americans who've been hurt by Obamacare. I recently saw a press release from the senior senator from California saying that she's heard from more than 30,000 constituents facing skyrocketing costs or canceled plans. Each story is unique. Each story is important. And that's why this morning Senate Republicans will share some of those stories to put a human face to those who've suffered as a result of the Democrats' decision to force this law on our country. I'll start off with James Dodson. He's a constituent of mine from Owensboro. James has type 2 diabetes. He recently got a letter informing him that his high-risk pool coverage would expire next month. He says a replacement plan on the Obamacare exchange will cause his premiums to spike from $676 to more than $1,000 a month. And here's the question he asked me. Where are the savings? Where are the savings the Democrats promised 3 years ago? James' story is another reminder why it's time for Democrats to work with us to repeal this law and start over with bipartisan reform. My constituent James is counting on them, and so are millions of others across the country suffering under this law. Now I understand my friend from Texas has something he'd like to share.
Mr. President, earlier this month I launched a website where my constituents in Texas could describe their experiences with Obamacare. As of this morning, that site has received more than 500 submissions, and the stories are simply maddening. Take, for example, Barry Linden of Brenham, Texas. He's currently waiting for an organ transplant, but because of Obamacare, his health insurance policy is being canceled, which could jeopardize his ability to access that transplant. As Mr. Linden writes, losing his health care plan, quote, is a potential life-ending tragedy for me and my family. The forced dropping of my plan creates a variety of complications involving my transplant team and my medications, close quote. He adds, the most troubling thing is that insurance will have to recertify my transplant. In other words, he'll have to start all over again. Meanwhile, I've also heard from another constituent in Lubbock, Texas, whose 13-year-old daughter has type 1 diabetes. She's had it since age 4. Her family has a health insurance policy when she was first diagnosed, and they're happy with that policy. But because of Obamacare, they were recently notified that their daughter's health insurance is being canceled in December. Stories like this, Mr. President, are simply infuriating, and they're unnecessary. But they should strengthen our resolve to dismantle Obamacare entirely and replace it with patient-centered alternatives. I yield the floor.
Mr. President, the news out of South Dakota is like it is everywhere else. It's all bad. It's cancellation notices and sticker shock that families, individuals, small businesses are experiencing. This is a letter from a couple that I received from my state. It says, we got the letter. We just received a cancellation letter from our health care provider. I'm a self-employed plumber. We've had the same kind of health insurance for years. It works for us. We're happy with it. When our current plan expires in 2014, it will no longer be available. We'll have to get a new plan. We'll be forced to lower our deductible, carry insurance for pregnancy, pediatric, eye, and dental care, etc. My wife is 50 years old. I'm almost there. We don't need coverage for pregnancy or pediatric care. We were told that our new policy will most likely cost us over 100% more than what we pay now. We will not be able to afford it. We will be without insurance, and I guess we'll have to pay the Obama tax and take our chances. President Obama said we could keep our plan, period. Mr. President, this is another example from my state, cancellations and sticker shock. That's the experience that Americans are having today with Obamacare.
President, the Tennessean reported yesterday morning in its headline that the state's largest underwriter is notifying 66,000 clients their policies don't meet ACA coverage requirements. In other words, they're losing those policies. I have a letter from a woman named Emily in Middle Tennessee, who was one of 16,000 Tennesseans who's part of yet another plan called Cover 10, she's losing her policy. She says, I'm 39 years old, single woman, chronic illness, lupus. I worked my way through college. As a person with a chronic illness that was deemed uninsurable, the only way I was able to obtain health insurance was through an employer-based program called Cover 10. Some call it minimal coverage. It's been stellar and affordable for me. I was excited about the Affordable Health Care Act. Glad to hear that uninsurables could be covered. But that's not true. I cannot keep my plan because it doesn't meet the standards of coverage. This alone is a travesty. Cover 10 has been a lifeline. With the discontinuation of it, I'm being forced to purchase a plan that increases my costs by a staggering 410%. My out-of-pocket expense will increase by more than $6,000 a year. Please help me understand how this is affordable. I beg of you to continue the fight for those like me who would only ask to be allowed to continue to have what we already enjoy, a fair health insurance plan at a fair price. That's Emily, a 39-year-old woman from Tennessee. Thank you, Mr. President.
If you like your health plan, you can keep it. It's a nice soundbite, isn't it? But it's also not true. My constituents have learned that the very hard way. Like this one from Perry, Iowa, who wrote to me, quote, my husband and I are farmers. For 9 years now, we have bought our own policy. We recently received a letter that our plan was going away, and effective January 1st, 2014, we will be updated to comply with the mandates of Obamacare. We did not get to keep our current policy. We did not get to keep our lower rates. I now have to pay for coverage that I do not want and probably will never use. We're the small business owners that are trying to live the American dream. I do not believe in large government that wants to run my life, end of quote. This failed promise is hitting home, but more importantly, when the president promises something and doesn't keep that promise, it goes way beyond a promise to hurt an individual. It goes to the lack of credibility of all government. And what we need to be doing in this country is building up credibility of government to strengthen our institutions of government. I yield the floor.
Mr. President, I join my colleagues on the floor today because I, like many of them, have many upset constituents. Idahoans are finding out that the president's promise to the American people that if you like your health care plan, you can keep it, simply was not true. Over 100,000 Idahoans will find that they cannot keep their current plans. Idahoans like Jennifer from Salmon, Idaho, are finding this out the hard way. Jennifer is a working, self-employed mother of 3 whose current health care coverage costs her family $375 a month. Now Jennifer's being told that her current plan is no longer available under the president's health care law and that the next available plan to her family will cost $900 per month with a $10,000 deductible. That plan will require Jennifer to spend $20,000 a year between premiums and deductibles before she has benefit coverage. Then there's Kelly, another hardworking mother from Boise who was promised affordable and accessible health care coverage under Obamacare. Optimistic to enroll, Kelly and her husband looked to sign up only to find the plans available to their family were unaffordable and thus inaccessible. The health care law was sold on the premise that it would help families like Kelly's. Those struggling to get by month to month on our stifled economy could obtain affordable, quality health insurance. Instead, Kelly and her husband are now considering taking the penalty fine for being uninsured under the new law, as it is a more feasible option for their family at this time. There are many more just like Kelly and Jennifer in Idaho and across the country dealing with new hardships as a result of this law. The President needs to work with Congress to find reasonable solutions to amend the many broken promises made about this law. Thank you, Mr. President. I yield the floor.
Mr. President, Beth from Tribune, Kansas, is the single mother of a 3-year-old son with significant physical disabilities. Her son's insurance is being canceled. To replace this policy with a similar plan, it's going to cost far more than the $750 monthly premium Beth does pay now. She writes, "How can this be? My little boy needs health insurance. Now our insurance company is telling us this policy no longer exists because it doesn't meet the government requirements, and if we'd like to get another plan, it's going to cost even more for the same child. We didn't change children. It's the same child. This doesn't make sense. We frequently visit multiple specialists. We need this insurance. It baffles me as to why this is happening. It's not rocket science. It's health care. Obamacare is affecting the people that need it the most, and not in a good way. It's very stressful raising a child with significant needs. I'd like to be concentrating on the health and well-being of my son and not on stressing out over health insurance. For Beth and her son, we must repeal this law. I yield back.
Mr. President, according to the U.S. Department of Health and Human Services, my state of Mississippi will have the third highest premiums in the nation as a result of the so-called Affordable Health Care Act. This is unacceptable for my state, and you can be sure I'm hearing from my constituents about this. For example, a married couple in Long Beach who own a small business. The private insurance plan they've offered to their employees for over 20 years will suffer a 33% premium increase on December 1st. Their insurer specifically cited the ACA's mandated coverage, fees, and taxes for the increased premiums. The couple will continue to insure their employees because if they were to discontinue this, their employees and families would suffer because they would not be able to afford individual plans. I've also heard from a 50-year-old graphic designer from Madison, Mississippi, who received a letter from his insurance provider stating that his insurance premiums will double at the beginning of the year from $355 to $755. This gentleman is understandably angry about his premium increase. He understands that his insurance will now cover mandated benefits like maternity care and birth control, something he will never use as a 58-year-old male. I've also heard from a 51-year-old disabled retired doctor, the father of 2 high school students. Earlier this week, he was informed by his insurance provider that his family's premiums will skyrocket in January. He's since discovered that the least expensive coverage for his family will result in a 112% increase in his premiums. And after hours on the healthcare.gov trying to enroll his family, a firefighter, a father, and a husband discovered that the cheapest plan, a bronze plan, will be too exorbitant a cost for him to pay. He will opt to pay the penalty, and he and his family will remain uninsured. Mr. President, these are real Americans who are learning that the Affordable Care Act is less affordable and less accessible.
Mr. President, we all know that over 5 million Americans have lost their health care and can't keep the health care they wanted. The untold tragedy are the millions and millions more who are being priced out of the market by the increases caused by Obamacare. I want to read an email from Rob and Jessica DeFore of Woodstock, Georgia, that I think depicts exactly what that tragedy is. My husband lost his job in the recession. He could not find work, so we started our own business and have grown it over the last 3 years so that we are supporting ourselves with a modest income. We lost all our savings in the process of the recession and building the business, but we are proud from where we've come and where we're going. We're in our 40s, healthy and insured. We just received a letter from our insurance company that our insurance will be going up 244% from $203 a month to $495 a month in 2014. We cannot believe our government has made a decision that is costing us and everyone we talk to thousands of dollars. It is truly unbelievable. We have worked so hard to get where we are now and cannot afford this increase. Obamacare is pricing the average American out of their health care. I yield back.
Mr. President, I rise to discuss the impact that Obamacare is already having on constituents, likewise, as my colleague said, in my home state of Georgia. One of my constituents, Jeannie, from Twin City, Georgia, is a registered nurse at a small hospital. Her husband's a retired Navy officer who served this country honorably for 20 years. They're on TRICARE, so Jenny didn't need her employer to pay for her health care. However, because of Obamacare, Jeannie's employer is cutting her hours to less than 30 hours a week, which means a drastic pay cut for her and her family. I fear this health care law will continue to force employers to reduce employee hours in order to avoid the unaffordable health care cost. Another constituent, Thomas from Columbus, told me about the problem he's facing with his son. His son graduated from college, but like so many his age, has been unable to find a job in this tough economy. His son works hard to make ends meet and was lucky to find a bartending position that would allow him to work full-time. Service industry professionals normally, as in the case of Thomas's son, receive benefits. So Thomas bought his son a catastrophic insurance plan that they could afford. Now it looks certain that this plan is not going to be acceptable under Obamacare. So his son will not qualify for Medicaid, but will not be able to afford the premiums that he will now have to pay for this catastrophic policy. Our economy is still recovering and Americans are still struggling. Thomas and Jeannie are exactly the type of hardworking Americans that health care reform should be making life easier for and not harder. It's time for the President and Democrats to join us in scrapping this law and starting anew. Mr. President, I yield the floor.
Mr. President, a few weeks ago, we opened up our website to Nebraskans so they could tell us what they were dealing with Obamacare. I heard from a family in Grand Island, Nebraska. This is what they say. Obamacare has made the prospect of getting sick very scary at our house. Our monthly premium is set to go up $578 to $714. It's not bad enough. Our maximum out-of-pocket will go from $5,000 to $12,700. Mr. President, this family is facing a 24% increase in premiums and a whopping 154% increase in their out-of-pocket maximum. The letter goes on to say, that's not affordable. In fact, if a member of my family were to get sick and need hospitalization, we'd be in major financial trouble. Not only that, but we only qualify for a $6 credit. It really feels as though those of us who work hard, do the right thing, and set good examples for our children are now being punished, unquote. Mr. President, it is time to stand with the American people and actually fulfill our promises and repeal this law. I yield the floor.
Mr. President, thousands of Mainers are receiving notices that their health insurance is being canceled due to Obamacare. This past weekend, I talked with Mark Pendergast, the owner of a small landscaping company, who just found out that the premiums for his small business plan will jump by 54% next year due to Obamacare. He can't pay that and stay competitive, and his workers can't afford it either. Their share of the premium will go up by $740 next year. Mark's worried that they'll simply drop their coverage and pay the fine instead. Mark and his workers are not the only Mainers hurt by Obamacare. Mrs. Beatrice Logan of Cape Elizabeth, Maine, emailed me to express her deep concern that her family is facing an increase in their deductible from $4,500 to $12,000. Moreover, she's being told that they may not be able to continue with the health care team at Boston's Children's Hospital that has provided a lifetime of excellent care to her 19-year-old son who has cystic fibrosis. Dave Eshelman of Falmouth told me that he and his wife are facing more than a 90% increase in their premiums. Having to spend an additional $5,000 a year for health insurance is no small matter to them at a time when they are struggling to start a small business. Mr. President, one of the major reasons that I strongly oppose the Affordable Health Care Act was that there was nothing affordable about it. I predicted it would lead to fewer choices and higher insurance costs for middle-income families and small businesses. Congress must work together to address the very real health care concerns of the American people and the budget realities we face. Repealing Obamacare's poorly crafted and misguided mandates and replacing the law with a fiscally responsible reform bill that contains costs and provides more choices is the best path forward. Thank you, Mr. President.
Mr. President, Gina Sell is a 29-year-old registered nurse, a wife, a mother of 2 girls, and a lifelong Wisconsin native. She and her husband, Joe, a heating and air conditioning technician, currently purchase health insurance on the individual market. Their best option under Obamacare increases their monthly premium by $700 and their deductible by $12,000 per year. This is after an annual Obamacare subsidy of $48. Because they both work, Gina and Joe make too much money to obtain an adequate subsidy, but not enough to afford health insurance. So what can they do? Gina has looked for a full-time job that provides health benefits, but those jobs are pretty scarce. Her only option may be to quit working altogether so they qualify for a larger subsidy. Because of Obamacare, Gina might lose a career she loves, and America might lose a much-needed nurse. In Gina's words, this scenario is life-altering. My husband and I are at a loss for what we can do. I yield the floor.
Mr. President, many people supported President Obama's health care law based on his promises. Those words don't mean much now to the millions of people receiving cancellation notices from insurers for their current plans, paying prices higher than promised, and losing work hours, wages, and in some cases jobs. In Wyoming alone, there are over 2,600 people who are losing health care coverage they liked. I've received numerous letters from my constituents illustrating the scope of this problem. Greta from Laramie is one of them. Greta's a graduate in graduate school and paying for tuition out of pocket. She had the university student Blue Cross Blue Shield insurance plan. In September, her husband and 2 daughters received notice that their family insurance policy was gone. They were happy with their coverage. Greta said their plan had very good coverage of maternity and well-child visits, low deductibles, and an affordable monthly premium. Her family can't afford a new health insurance plan, which, according to her, costs more and gives me less. That's what we're facing as a nation: health care plans we can no longer keep and broken promises from the White House. The president misinformed the American people when he said, if you like your health care plan, you can keep it. Just last week, he said the Democrats didn't do a good enough job crafting the law. To me, that sounds like a law that should have never been passed. We must continue to push for repeal of this law of broken promises and work on alternative solutions that really do what the people were promised. I yield the floor.
Mr. President, Sonia and Jake, her husband, are from Troy, Missouri. She contacted us to tell me that when her husband quit his job a few years ago to start his own business, they, of course, when that happened, lost their employer coverage, but they were able to go check on health care coverage for the self-employed, and they found what they thought was a really doable policy for them. They're young, they're healthy, they have 6 kids, but they're all pretty healthy. They were paying $400 a month with a $5,000 deductible, 100% coverage after the $5,000. Their preventative care was already covered, but of course their policy just got canceled because it didn't meet the Obamacare guidelines. Their insurance company tells them to get the same kind of coverage with the new guidelines, they're going to pay 125% more than they've been paying. Their insurance more than doubled. Their plan may not have been good enough for the new guidelines, but it was good enough for them. When the government begins to tell people what they have to have, that almost always costs people more. And also we're seeing the high risk pool in our state and every state go away. I'm having all kinds of people saying their insurance is going to cost more, their deductible is higher, and more, and many, many times the doctor that's been part of their health care challenge right up till now is no longer available to them. So much for if you like your doctor, you can keep your doctor.
Mr. President, it's great we have the opportunity to come to the floor today to talk about what our constituents are telling us. We don't do that enough. Last night I had a teletown hall meeting. We had about 25,000 Ohioans on. Every one of these teletown halls, we do a poll asking what the most important issue is. And of the teletown halls we've done, which is one a month, every single time it's been jobs and the economy, until last night. Last night it was health care. That's because most of the questions I got were about health care coverage and people concerned about losing it. Let me read a letter from one of my constituents, and it's indicative of what I'm hearing all around the state. This is from Dean. He lives in Sandusky, Ohio. He writes, "Ever since I lost my job in 2009, I've been purchasing my own health care insurance. Last month, I received a letter in the mail stating that my plan is being canceled due to the ACA. I was told to look at plans on the exchange, which I did, and I found a comparable plan that is over twice the cost of what I have now. In addition, this is over half of my monthly pension. I simply can't afford this. I've always been a responsible, hardworking, self-dependent person. Now, due to the actions of our government, for the first time in my life, I will not have any health insurance coverage. I'm 59 years old, and I need this coverage. I'm outraged, to say the least. How can our government do this to us? I will remember this come election time. Please get rid of this insane law. This is unacceptable." Well, to Dean and to my other constituents, I agree with you. It is unacceptable. We should repeal the law. It doesn't make sense. And then replace it with forms that actually reduce the cost of health care and keep the promise the President made, which is that people can keep the health care that they have.
Mr. President, the President has publicly promised all Americans, if you like your plan, you can keep it. If you like your doctor, you can keep that doctor. The only change, he said, you'll see are falling costs. Well, Donna, senior citizen from New Albany, who are not supposed to be, senior citizens are not supposed to be affected by this Obamacare. She received a letter telling that she and her husband no longer could keep their Medicare Advantage plan. It was terminated. And so they found another plan. Much higher cost, much higher premium, much higher deductible. Cynthia from Lafayette, Indiana. I'm a self-employed and purchase health care privately. I'm a single parent with a mortgage payment and a child in high school. I was given an estimate for a plan. My plan was canceled, and I was given an estimate for a replacement plan almost double of what I'm paying today. Mr. President, you have not kept your promises for seniors. You have not kept your promise to single working mothers. You have not kept your promise to families. You've not kept your promise to the people that I represent. How can Americans trust that this government takeover will work if you can't keep your promises to the American people?
In North Dakota, we've got a lot of farmers and we've got a lot of ranchers, and they're small business people. They run a small business, and they're being hit very hard by Obamacare like other small businesses across this country. A rancher from Rame contacted us. His name's Wayne, and he ranches there. You know, Rame's an area where we have a lot of cowboys, a tremendous rodeo. They compete nationally, and they have great livestock herds there. But he writes in, he says, "I'm not one to get too upset about things, but this deal really has me mad. We got a letter a few weeks ago that said they were dropping our policy. I've paid my own insurance for years and years. When I got that letter, it just hit me, because somebody in Washington decided I was too stupid to figure it out if my policy was right for me or not. I don't pay a lot of attention to politics, but usually what gets decided in Washington doesn't slap you in the face like this law has with me," he says. "I've gone on healthcare.gov and used the estimators they direct you to. I could be going from a $2,500 deductible to something between $10,000 and $12,000, the way it looks to me. This is going to cost me a lot more for something I don't even want." And if I could, I'd like to read just another short story from a couple in Grand Forks that got a hold of us on the marriage penalty that Obamacare creates. She writes in, "My husband and I met with the primary health insurance carrier in North Dakota, and we're told that our current coverage under the guidelines of the Affordable Care Act will cost us at least another $400 more a month, and our deductible will increase from $2,000 to $12,000. And because we're married, we cannot choose individual plans, which would be a lower deductible. In essence, we're being punished for being married. We are looking at paying more than $1,500 a month in health care because we are only 61 years old and not eligible for Medicare for another 4 years. $18,000 a year for health care. We were told that part of the problem is the provisions in the law require us to choose a plan that has maternity benefits. How does this make sense for seniors to be forced to buy coverage that does not apply to them? We agree the benefits shouldn't be denied to people, but it's not fair to be forced to buy coverage that doesn't even apply.
Mr. President, I rise today to speak on behalf of nearly 3,000 Nebraskans who have contacted my office with their concerns about Obamacare. Their stories are unfortunately not unique. Skyrocketing premiums and cancellation of plans that they were promised that they could keep. Kurt from Lincoln, Nebraska wrote to tell me he has seen his Blue Cross Blue Shield premium rise a shocking 300%. David, a father living in Omaha, is facing a potential total increase of $16,000 a year for his family's coverage. $16,000. Another constituent from Bertrand, Nebraska will see his family's deductible more than double next year. He asked, how is this the Affordable Care Act? An apology now won't help the hardworking Nebraskans who have lost or who will soon lose their current coverage. One constituent wrote, folks shouldn't need a second mortgage to pay for Obamacare. I agree. I yield the floor.
Senator from Wyoming, I get home every weekend, talk to people, was home this weekend and for Veterans Day, and was in the Target store in Casper, ran into a small business owner, has a small electrics company that he runs. He has about 4 people that work with him. And he's somebody I've operated on. He's a former patient of mine, and he told me that he was one of those 4 million Americans who had gotten that letter that he had lost his insurance. He said, you know, the president promised that this would be easier to use than Amazon.com. I said, I can't get on. He said, it'd be cheaper than your cell phone bill. He said, well, that's not been the case. And he said, the president said, if you like what you have, you can keep it. Clearly not the case. He said, what's wrong? What's wrong with this? How can we fix it? I got another letter from a rancher I need to read to you, Mr. President, from Newcastle, Wyoming. She says, we're ranchers. We're ranchers who buy our own health insurance. Currently, we pay $650 a month for an 80-20 policy with a $3,500 deductible. She says our maximum family out-of-pocket is $10,000 a year. We don't carry maternity insurance, she said, because we've completed our family. She said, I'm 45 years old, and she said, I've had a hysterectomy. So she said, I recently called my insurance agent out of fear our policy would be canceled. Well, he said it would be canceled at the renewal time. She says that he told me that their policy didn't meet Obama's requirement because of maternity coverage, and they'd have to choose a policy from the exchanges. Now remember, she's had a hysterectomy. She doesn't need or want or ever going to use maternity coverage. She said that the insurance agents quoted her rates for a comparable policy at $1,300 to $1,600 per month. Remember, they're now paying $650. He said the insurance agent also told me that they could take a bronze policy, much less coverage than they currently have, for $900, still $250 a month higher than they'd have to pay. But the out-of-pocket cost then was much higher, much more difficult for the family. He said, we're being forced out of a good policy, which we pay for with hard-earned money, and which we choose, she says, into a dangerous financial and health care situation with less coverage, and which puts my husband and I, who are proud of our sustainability, onto what we consider the welfare rolls by needing a government subsidy to afford a plan that we don't want or need. She said, to say that we are angry is an understatement. Why is this happening? Why can Obama force me into this? We feel helpless. So what are we supposed to do? Just follow like sheep until we're either bankrupt or welfare recipients? Mr. President, this is not what the President of the United States promised the American people. It's not what every Democrat in this body who voted for this health care law promised the American people. The American people deserve better. They deserve to be able to get the care that they need from a doctor that they choose at lower costs. None of that has come true under this health care law. Thank you, Mr. President. I yield the floor.
Mr. President, the more my constituents learn about the administration's so-called Affordable Care Act, the more it becomes clear that major changes should be considered. I recently heard from a constituent who had learned from accessing the Obama administration's enrollment website that the plan with the lowest cost available to him has a $7,000 yearly deductible with a $12,000 out-of-pocket maximum and a premium of a little over $2,400 a month, nearly twice as much as he and his wife currently pay. This family is just one example of millions of Americans who are suffering from sticker shock because of the cost of insurance plans on the President's new health insurance exchanges. The shock is made worse for those who are being rejected by the plans that they were told they could keep but now cannot. It's clear we need to urge the administration to consider going back to the drawing board. We should get together, too, here in the Senate and find common ground that makes better sense for the American people.
Thank you, Mr. President. For the last 3 years, we've heard President Obama and our friends on the left promise, no guarantee, that Obamacare will make health insurance more affordable. But day after day, we see costs going up for hardworking families all across our country. Not merely the rich families, not just the 1%, but middle-class Americans. Last week, I heard from Natalie Geiger, a wife and a mother of 3 in Charleston, South Carolina, whose health insurance costs are seeing double-digit increases. Mr. President, these are the faces of real people impacted by Obamacare. They're not stats, they're not numbers, they don't get waivers, they're taxpayers, middle-income taxpayers. And Obamacare is forcing many to choose between saving for college for these 3 little kids and paying for health care. They shouldn't have to choose. Obamacare and healthcare.gov are words we now know are synonymous with failure. I yield the floor.
Thank you, Mr. President. I'd like to tell the story of a constituent that emailed me that is so representative of what thousands are going through in Arkansas. This is Mark from Little Rock. He wrote me after receiving his cancellation notice. Here's what he had to say. I recently received from Blue Cross Blue Shield that my individual health insurance policy will not be renewed after 2014 due to Obamacare. Although I am very happy with this policy, I'm being forced out of it after 2014. The alternative options under the Affordable Care Act are not very affordable. The closest alternative plan will increase my deductible 25% and increase my monthly premiums 300% from $285 a month to $850 a month. Mark goes on to note that his current plan is Blue Cross, which he describes as not a bad apple provider, and that he will be required to pay for the entire cost of this new plan out of pocket. These are all very serious problems with the program, and certainly Mark is not alone.
Mr. President, I recently received a letter from Kathleen Steffen of Fletcher, North Carolina, who wrote me to describe her experience with the Affordable Care Act and the impact on her health care. And I'd like to read her letter versus to paraphrase it. She said, "Dear Senator Burr, I recently received a notice from Blue Cross Blue Shield of North Carolina that my health insurance policy will be canceled effective January 1, 2014, because it does not meet all the mandates under Obamacare. My current premium is $418 a month. The replacement policy being recommended to me will cost $928 a month, a 122% increase, and I don't qualify for subsidies. I've had continuous coverage with Blue Cross Blue Shield for many years, and I like my current plan. I'm a 62-year-old woman and will not benefit from the mandatory additions to my plan, such as maternity coverage, newborn, and pediatric care. In the past, having a continuous coverage provided a sense of security that my rates could not be raised based on a change in my health status. I experienced such a change in 2012 when I was diagnosed with breast cancer and underwent 7 months of treatment. Now, my rates are more than doubling. The security's gone, not because of the change in my health, but because of Obamacare. When President Obama was selling the Affordable Care Act to the American people, he repeatedly promised, if you like your health care plan, you can keep your health care plan, period. I'm writing to you today to tell you that I do like my plan, and I want to keep it. I'm asking for fairness for myself and for the estimated millions of other Americans who've had their plan taken away by Obamacare. Sincerely, Kathleen Steffen. Mr. President, how do I answer Kathleen's letter? I yield the floor.
Mr. President, every one of us can stand up here and tell thousands of stories. Mine would come from a gentleman by the name of Clint W., who is a small business owner, received notice that he wasn't grandfathered, was being canceled as of the first of the year. Premiums went from $320 to $1,200. His deductible went from $5,000 to $12,700. Says he can't afford it, and he canceled the policy so that he could save some money for future medical expenses, and he's going to stay canceled as long as he possibly can. You know what struck me about this, and I didn't get a lot of letters from poor people. I didn't get a lot of letters or contacts from rich people. Where my contacts came from was middle-class America, which is what this country is. We are a middle-class country, by and large, with a small sliver of rich people at one end and some people that are deserving of our help at the other end. But who are primarily affected by this are the middle class of America. Now, my good friends on the other side try to claim that they're the party that represents the middle class of America. I don't know if they're getting the same letters that we are, but if they are, they realize that they've done something horrible. They didn't do a plan here to help disadvantage, which the Republican Party has always helped with. What they have done is a social experiment that is collectivism or socialism at its worst. It's obvious it's a failure. These things don't work. The American people, over 200 years, built up a very successful insurance system and healthcare system in America, and in 3 years, this thing has been destroyed. There's 44 days left to make this thing work, and if this isn't done right, there's going to be a collapse come January 1st, and the American people are going to know exactly who caused it. Thank you, Mr. President.
Mr. President, one of the things that hasn't been discussed is the impact that Obamacare is having on Medicare and Medicare beneficiaries. Obviously, being from Florida, we have a significant number of Medicare beneficiaries, and in particular, people that are under something called Medicare Advantage, which is the only program in Medicare where seniors get to choose their coverage, the type of coverage they want, things of that nature. My mom's a Medicare Advantage patient. So I wanted to read briefly, if I could, a letter that I received from a constituent of mine named Michelle Hatley, who lives in Destin, Florida, which is in northwest Florida. And it's a letter that she received regarding her existing doctors. She also got a letter from her, one of her providers that talks about the changes that are happening. Let me read you the email. She sent this attached with it. Here's a copy of the letter that I received from White Wilson Medical Group. As I indicated in our conversation, Sacred Heart might be also affected. My Medicare Advantage plan was the Medicare Completer through AARP and the United Healthcare. I have multiple chronic conditions which require treatment and consultation through several doctors. 3 of my doctors are with White Wilson, and 3 are with Sacred Heart. My rheumatologist, who directs my care for treatment of 2 autoimmune conditions, including rheumatoid arthritis, is with Sacred Heart, and the only rheumatologist in Destin. I am also legally blind, so transport to another doctor out of town is both difficult to arrange and expensive. Of the plans that are available that will allow me to keep my doctors, the annual out-of-pocket is significantly higher, as well as the co-payments and the deductibles for patient visits, prescription drugs, and inpatient care. My choice has been reduced to finding all new doctors or enrolling in a different Medicare Advantage plan, which will cost more. I wanted the Senator to be aware that Medicare clients are experiencing negative consequences from ACA as well. Since that time, by the way, after this experience, she has been able to find a plan that helps her avoid all 6 of her doctors, including the 5 specialists and her primary care physician. But here's the catch. This new plan, its out-of-pocket costs are now going from $4,000 to $4,500 range. It's now going up to an expected $5,900. It was a tough decision for her to make, but she ultimately decided to pay more money in order to keep seeing all her doctors that have been treating her for the past 4 to 6 years. This is a real-life story of a Medicare Advantage recipient in this country whose out-of-pocket costs are going up because of Obamacare. It is wrong. It is unfair. It should not stand. I yield the floor.
Thank you, Mr. President. I came to the floor yesterday to share so many stories that I'm receiving from my constituents about them receiving cancellations for policies that they wanted to keep, higher premiums under this law. Each story is very sad, and I feel badly for the people of my state and across this country who are suffering under this law. My constituents are pleading for relief. Here's just one example. A small business owner from Peterborough, New Hampshire, who voted for President Obama twice, told me that her family has a household income of $50,000, and their total health insurance will now cost over $19,000 for the year, which is more than their mortgage. And their local hospital isn't even on the exchange, because in New Hampshire, we only have 1 insurer on the exchange, and 10 of our 26 hospitals have been excluded from that exchange. This constituent from Peterborough wrote to me, "We are frustrated, afraid, and angry beyond words. I urge a postponement of implementation of the Affordable Care Act while those with the power look harder at the average American and come up with a better plan. Life shouldn't be this hard." Mr. President, citizens from across New Hampshire and this country are crying out for relief. I hope the President will listen to them and call a timeout on this law so that we can come together and, rather than what was done in this chamber, passing a partisan law, come together for bipartisan health care solutions. Thank you, Mr. President.
Mr. President, it's hard to narrow down the best story to tell. In fact, they're all bad stories. They're all terrible stories. But Kansans, too, are struggling under the consequences of the passage of the Affordable Care Act. And it bothers me so many times it's suggested that this is just a problem with implementation. But the problems that Americans and Kansans are facing today really is the crux, the underlying basis for the provisions of the Affordable Care Act. This is not a problem just with implementation. It's not just a computer problem. It's the theory on which the Affordable Care Act was based. Example I'd like to describe to my colleagues from the Senate is from a constituent in Newton, Kansas, right in the center of the state. And he writes to tell me that we were notified by our health insurance carrier that our premiums on our small business plan were to increase 24% on our renewal date because of the coverage mandated by the Affordable Care Act starting in 2014. As a small business owner in our late 50s, we have struggled to find affordable health care insurance for years. About 2 years ago, we were able to sign up for a plan offered to small businesses through a well-known carrier. It's not a Cadillac plan, since we each had a $5,000 deductible and no coverage for maternity we didn't need, contraception we didn't need, but it covered the things we wanted and we did need. Unfortunately, the premium increase is going to put this plan in the unaffordable range once again. I've not yet been able to get on healthcare.gov. The few times I've tried, it's either been down or locked up during access. As a business owner with employees and responsibilities, the time I have to spend messing around with a slow or non-responsive website is limited and expensive. Mr. President, our constituents need help, and the Affordable Care Act is what they need help from. I yield the floor.
The President promised the American people if you liked your doctor, you could keep him or her. Promised if you liked your insurance, you could keep it. Well, he needs to tell Andy Mangione and his family why they can't keep their insurance. They had an individual policy they were happy with. They paid $300 a month. They're now going to be asked to pay $900 a month for things that they don't want and they didn't choose to have. This isn't really just about health care. This is about freedom of choice. This is about whether or not you can choose what type of insurance you want. The question is, what's next? What choices will be taken from us? I'm going to be signing up for Obamacare. I tried yesterday 15 times. I wasn't able to get beyond create an account because every time I pushed create an account, nothing happened. This is a real problem. 5 million people without insurance. The President said if you can keep your insurance, you should be allowed to. You can keep your doctor. Something has to be done because the Mangione family is going to have to pay 3 times as much for an insurance policy they don't want. We're taking their freedom of choice away. I, for one, say enough's enough. Let's get rid of this. Let's give back freedom to the consumer, give back freedom to Kentucky families. In Kentucky, 10 times more families have been canceled than have actually gotten on. Something has to give. Mr. President, if you said we can keep our doctor, come forward and tell us why we can't keep our doctor. Thank you very much.
Mr. President, millions across this country are losing their health care, are losing their doctors because of Obamacare. In Texas this past week, the Austin American-Statesman reported that Austin's largest provider of cancer treatment won't participate in the health insurance plans offered through the marketplace set up by the Affordable Care Act. And indeed, they went on to quote, "Obamacare looked like sunshine on the horizon, and now it's a tornado," said one Austinite who has breast cancer and is being treated at Texas Oncology. In an upcoming issue, Texas Medicine, a publication from the Texas Medical Association, references a survey by the Medical Group Management Association that says uncertainty has 40% of physician practices across the country pondering their participation in marketplace-based insurance plans. And by reducing their risk, Texas Oncology is passing a burden on to some already stressed families, said Seth Winnick, whose wife is being treated by Texas Oncology for breast cancer. Quote, "It's an unwelcome burden and could seriously affect thousands of families who deal with cancer in our communities. If Winnick's family is forced to pay out-of-network rates to treat his wife, the family will have to make some tough decisions. We will make the financial sacrifice necessary to purchase the best care we can afford, and we hope that is enough." But Mr. Winnick continued, he had nothing positive to say about the people who provide care at Texas Oncology, but he also said expanding health care coverage to people who don't have it is a noble goal, but the impact that has on those of us who do have it remains to be seen. Folks in the individual market don't really know what is in store. Mr. President, President Obama promised the American people, if you like your health care plan, you can keep it. We now know that promise wasn't true. Obamacare isn't working, and it's time to start over. Thank you, Mr. President.
Mr. President, as my colleagues have said, I think all of us have heard from hundreds of our constituents in the past couple of weeks who have had their insurance policies canceled or their insurance policies have been made unaffordable by the Affordable Care Act. I want to talk for a minute about Greg and Linda. They live just a couple of doors down from me. I heard from Greg earlier this week. Greg and Linda are in their late 50s, early 60s. They know at this stage in life what kind of policy they need. They know what they don't need. They had a premium of about $400 under their old policy. They paid $440 to be exact. The new plan that they've been able to find that matches most closely with what they have now after their other policy was canceled would cost them just over $1,000, $1,055 to be exact. How is that affordable? The President promised, if you like your plan, you can keep it. If you like your doctor, you can keep it, him or her, period. That's not been the case. The President needs to explain to Greg and Linda and to hundreds or thousands of other Arizonans who are losing their health coverage how it is that he said that they could keep it and they now can't. I yield the floor.
Mr. President, the President of the United States promised, if you like your plan, you can keep it. We now all know that that simply wasn't true. And though many of us have been saying this for years, many Americans, including many in my state, are realizing the pain of the President's false statement. Dave from Utah says, my company just dropped the good insurance plan we've had for years due to Obamacare. The Affordable Care Act is costing me more money. I'm barely able to keep my family out of poverty, and now health care is going to cost me even more. Please do something to change this. Marcy from Utah says, we own a small business in Utah, and we will be forced to cancel our insurance and ourselves go on Obamacare. We can start over with a new way to fix our health care system. But starting over doesn't necessarily have to mean starting from scratch. We should take those lessons that we've learned, and we should build around the concept of a market-driven, patient-centered health care system, one that empowers individual Americans to choose their own health insurance based on their own personal needs and based on their own preferences. Thank you, Mr. President.
I have two stories I'll quickly share with the body from South Carolina. Scott from Goose Creek, South Carolina. I'm a college professor in Columbia, South Carolina at a private university. We're up for our insurance open enrollment. I'm 35 years old, vegetarian, never smoked, ridiculously low blood pressure and cholesterol. Obviously, I have nothing in common with Scott. I noticed the following about my policy. My share of premiums went up by 35 to 40%. In addition, my actual policy changed. My deductibles tripled from $250 to $750. I cannot get regular monthly prescriptions at my pharmacy now. I'm sure there are other changes that I have not examined close enough to notice. Thomas Dougal from Elgin, South Carolina. After submitting his personal information on healthcare.gov, received a phone call from a Mr. Justin Hadley, a North Carolina resident, who informed him that when he signed onto healthcare.gov, he received all of Mr. and Mrs. Dougal's personal information. This is beginning to be a very famous case. 572 people have been enrolled in Obamacare in the state of South Carolina. Mr. President, Obamacare is not working, and I fear it will never work, and the best way to fix it is to repeal it and replace it with something that will work. I yield the floor.
Mr. President, I have received letters from my constituents all over Utah who are scared, angry, and confused about the changes they're already facing under Obamacare. I've heard countless stories from Utahns that are losing their coverage and will be forced into more expensive plans thanks to the so-called Affordable Care Act. One such story came from Kathy in Salt Lake City. I spoke briefly about Kathy here on the floor a few weeks ago. Kathy wrote to tell me how she was notified by mail that her existing health care plan was no longer going to be offered. Instead, she was presented with an Obamacare compliant policy that will increase her deductible from $3,000 to $5,000, increase her copays for doctor visits to 30%, and increase her copays for prescription drugs for as much as 50%. As a result of these changes, Kathy's health care expenses will exceed her income. To quote Kathy, quote, "The claim that only substandard policies were canceled is a lie. The plan I was on was a good policy," unquote. She does not trust the new healthcare.gov website and feels that there is not adequate security to protect her personal information. In her words, quote, "I wouldn't touch the exchange with a 10-foot pole," unquote. She is not alone in feeling this way, which spells trouble for these new health care exchanges and for the President's health law. Mr. President, I yield the floor.